Tell us about your organisation and its work with registries.
So OpenAPP, we're based in Dublin, in Ireland. We're nearly 50 people. We've been working on registry since 2012. We've worked with a lot of patient organisations and clinical organisations across a lot of different domains.
What are some important considerations for maintaining a registry and keeping it updated?
It's maintaining the data set. Is it still relevant? The question's still relevant, so that when somebody comes to enter data, that the questions make sense to them. The drop downs have all those things that they need in there. That part of that is also making sure they keep feedback coming into the system, and a lot of that is very few people will keep entering data into the system into a system unless they get some feedback as well. So it's making sure that you communicate with your community, whether the platform does it or whether you do it on a regular basis through your newsletters to say the last survey we ran showed these results, or we now have interaction with these clinical organizations or research organizations. You're building up a story, and you're motivating people to come back and enter more data, because that's registry. It's all about data. If there's no data in a registry, it's of no use to anyone.
What do you think is the best way for people to let patients know the registry exists?
I guess it depends on the scope that they have. Is it a national scope or an international scope or global? There are other patient organizations out there you should be reaching out to. The rare disease community is very small in almost every country, and every other organization around the world, almost all of them have exactly the same problems as you have here. And it's when you combine your strength that you get to know the research network that you want to support. You get to know the pharmaceutical companies that have some interest in what you're doing. You get funding in to enhance what you're doing, and hopefully make that connection with enough of these researchers that a treatment, whether it's to reduce the symptoms or actually to cure the disease, hopefully that will come.
How do you think patient registries help improve patient care or impact on research?
Help improve patient care, even if you never got research. It allows clinicians to understand what's the prognosis for your disease. What is it that I'm doing in my expert centre that is different to my colleague in another country or in another expert centre, or somebody who uses different treatments and their treatments are working better than my treatments? I want to understand, is it the treatment? Is it the process? Is it the community setting? Is there genetics involved? And you have to be able to answer some of these things to help improve the care of your own patients.
What are your top tips for patient organisations looking to set up a registry?
Start small, start simple. If you don't have a clinical buy-in to what you're doing, agree among your own peers or among your own organisation that you want to do a patient registry. Understand what it is you're trying to do and start small. If you only ask 10 or 15 questions and you get everyone in your region or in your country or internationally to answer these questions, that is a gold mine by itself if you're asking the right questions.